The question is, an unusually tall 14-year-old boy with extremely long limbs came to the ophthalmologist with complaints of diminution of vision. On examination, there was bilateral subluxation of the lens, that is ectopia lentis. So they're asking us which of the following defect is found in this condition. So a 6-year-old boy is brought to the emergency department with complaints of fever and seizure. What is the most appropriate immediate treatment for control of seizures in this child? A mother is feeding her 7-month-old newborn baby thick homemade cereal as supplementary feeds on top of breastfeeding. So yeah, what is the volume and frequency of feeds most appropriate for this baby in a period of 24 hours based on the infant and young child feeding guidelines? So this is a newborn presents with deformity in all 4 limbs and there was no index finger in right hand. What is the likely diagnosis? You have a primary gravida mother who was diagnosed as HIV positive in 34 weeks of gestation. ART was initiated. A viral load of 1200 copies per ml was detected. The baby was delivered with a weight of 2.5 kg at term through vaginal delivery and the baby was healthy. So what is your next step in the management if the mother has decided to breastfeed the child? So agla question is, a neonate was screened and was found to have congenital hypothyroidism. T3 and T4 levels were decreased and there was no radio or tracer uptake. But the thyroid gland was normal on USG. So यहाँ पर likely cause क्या है वो पूछ रहे हैं. So question is, which of the following is an example of this inheritance? And here we have been given an pedigree chart. Along with that we have been given the multiple options जिसमें हमें right answer choose करने के लिए you have to first identify कि inheritance pattern यहाँ पर क्या है. The next question we have is a 2-year-old child who has choked on a peanut and is brought to you in an unresponsive state. What would be the next best step? So is what is the preferred drug to be given to the close contacts of a child with meningococcal meningitis? So the next question is, a child has clouded cornea and coarse facial features with developmental delay. You suspect a form of storage disorder based on these clinical findings and you have been asked what is accumulated in this syndrome. So next question, that is, a newborn presents with respiratory distress within 24 hours of life. You have been given the chest X-ray of the child and you have to identify the possible condition जो यहाँ पर दिया जा रहा है. So the next question is, a child with acute persistent asthma presents to you and you prescribe benralizumab. What is the mechanism of action of this drug? So the next question is, a 7-year-old boy comes to you with complaints of pain, abdomen and vomiting. On examination, the child looks dehydrated and you have been given the lab values, which are sodium as 122, potassium as 3.5. Both of them are on the lower side of the normal range. Bicarb is 10, which is definitely low, and blood glucose is 720 mg per dl, which is definitely high. What is not useful in treatment of the child according to the clinical condition? So what should be thought of in a child who has history of recurrent meningococcal meningitis? Question is, an 8-year-old boy comes with CKD and going off limbs. Serum calcium is 7.9, phosphate is 6.9, ALP is high, and PTH is normal. What to do next? Primary gravida presents to your clinic. The mother has lymphadenopathy on examination and there is history of toxoplasmosis infection 5 years back. Maternal IgG for toxoplasma, they are positive. So what is the best next step? Then you have the next question where you have a 6-month-old child who has a history of recurrent infections and not gaining weight. On laboratory investigations, there is deficiency of adenosine deaminase. This is the key word here. Out of the following, most likely immunodeficiency disorder. Let's continue with the next question. You have a child who presents to you with neurodegeneration and the child has cherry red spots on fundus examination. Enzyme assays reveal the child has hexosaminidase A deficiency. What is the most likely diagnosis? So the next question is, in the image given, you can see the different VVMs, that is vaccine vial monitors. You have to analyze the images and decide which of the vials can be used for vaccination at your clinic. The number of vessels in a normal umbilical cord. So